If you had an AFib ablation and you're thinking, did I go through all of that for nothing? This video is for you. Because if your heart is still racing, still fluttering, or still waking you up at night, it's very easy to assume that the procedure failed, but that's not always true. And even when AFib does come back, it does not mean that you're out of options. This is the moment where the next decision matters most. Do you wait? Do you restart medication? Do you need another ablation? Or is there something else triggering the rhythm again? So, in this video, I'm going to give you the roadmap. What recurrence actually means, what doctors look for next, and when a repeat ablation makes sense, and how to think about your best shot at long-term freedom from AFib. This is not the end of the road. This is the next step. Make sure you hit the like button on this video and subscribe to our channel. We post 3 videos per week and read every comment. Starting this channel has helped so many of you, and we are only just getting started. So let's get into it. A recurrence after ablation does not mean you're out of options. Not even close. In fact, the latest guidelines from the American College of Cardiology lay out a very clear, very structured roadmap for exactly what to do when this happens. And by the end of this video, you're going to understand that roadmap better than most people who haven't spent hours reading medical journals. First, let's talk about what's actually happening, because a lot of people walk out of an ablation thinking that it should be a one-and-done fix, and when it's not, they feel something has gone terribly wrong. And here's the truth. Recurrences after a first ablation happen in 30 to even 40% of patients in modern clinical trials. That's not a fringe outcome. That is a common, well-documented, medically expected possibility. In fact, in general US practice, about 11% of patients who had their first ablation end up having a repeat procedure within 1 year. And researchers who followed over 5,200 patients for up to 15 years found that after a single ablation, about 48% of patients experienced a recurrence, with the majority of those happening in the first year. So if you're in that group right now, you are definitely not an outlier. You are not a failure. You are in the middle of a process that for many people takes more than one step. And here's the myth I want to bust right now. If your ablation didn't work, you're stuck in AFib forever. And the reality is that the data shows that after all ablation procedures are accounted for, including repeat procedures, freedom from AFib at 5-year jumps to over 80% in paroxysmal AFib. And even for persistent AFib, outcomes improve substantially with each additional targeted procedure. This is a journey. It's not a single destination. And here's something that even more important that the research actually highlights. Even patients who experience recurrence often report improved symptoms and better quality of life compared to before the ablation. So, even partial success, reducing how often AFib happens, how long it lasts, how bad it feels, that is a clinically meaningful win. You don't have to be 100% AFib free to feel dramatically better. So, why does AFib come back after ablation in the first place? And the most common reason is something called pulmonary vein reconnection. Here's the simple version. During your ablation, your electrophysiologist, that's your heart rhythm specialist, created a ring of scar tissue around the pulmonary veins. Those are the veins that enter the left side of your heart and are the most common source of that electrical misfires that trigger AFib. The goal is to electrically isolate those veins to cut off the signal. But over time, in many patients, small gaps can form in that scar tissue. The electrical connection comes back, the misfire starts again. In fact, at repeat ablation procedures, pulmonary vein reconnection is found in up to 81% of patients. So in most cases, the fix isn't starting from scratch. It's going back in, finding where the connection came back, and finishing the job. Now, what are your actual options? Let's go through them one by one. Option 1. Repeat catheter ablation. This is the most recommended path for most symptomatic recurrences. The 2023 guidelines give this a Class 1 recommendation, which is the highest level of clinical endorsement. And randomized data shows repeat ablation procedures roughly 40% arrhythmia-free survival off of medications, compared to only 15% with medical management alone. That's a significant difference. And here's what the cumulative success numbers actually look like. After one ablation, freedom from AFib at 5 years is about 52. After a second ablation, that number climbs to 66, and after a third, it approaches 67. Each additional targeted procedure improves your odds. The pre-procedure success rate for second and third ablations is 57% to 60%, nearly identical to the first. Option 2, Antiarrhythmic drug therapy, even if it didn't work before. This surprises a lot of people. The guidelines specifically note that antiarrhythmic meds can be effective after ablation even when they failed before ablation. Why? Because ablation changes the electrical substrate of the heart. The drugs work differently in a heart that's been modified. This can be used alone or increasingly common combined with an ablation, and this is called the hybrid approach. Option 3. Short-term post-ablation medication. If you're still in that first 3 to 6 month window, your doctor may recommend a short course of antiarrhythmic medication. Meta-analysis of randomized trials show that this significantly reduces early recurrences. Observational data also shows that it can cut hospital admissions by 37% in the first 90 days. This isn't a long-term fix, it's a bridge strategy while your heart heals. Option 4. Surgical ablation, the maze procedure. For patients who have had multiple ablations and are still struggling, or for those who need open heart surgery for another reason, the surgical maze procedure is a powerful option. It creates a precise pattern of scar tissue throughout the upper chambers of the heart to permanently redirect electrical signals. It's a bigger intervention, but for the right patient, it can be highly effective. Option 5. Rate control and risk factor modification. Sometimes the most powerful thing you can do doesn't happen in a procedure room at all. Treating obesity, sleep apnea, please do, high blood pressure and reducing alcohol have all been shown to meaningfully improve the maintenance of normal rhythm. These aren't optional lifestyle suggestions, they are active, evidence-based treatment for AFib recurrence. Now let me address the concerns I know are running through your head right now. Is it safe to have a second or third ablation? Yes, with important caveats. Repeat ablations do carry a slightly higher risk of rare complications, including something called pulmonary vein stenosis, where the scar tissue narrows the vein, and stiff left atrial syndrome, where the left atrium loses some of its flexibility. These are uncommon, but they are real risks that you need to discuss with your electrophysiologist before moving forward. The absolute limit to how many ablations a person can safely have is not definitively established, but the data does suggest that after a third procedure, the incremental benefit begins to plateau. So, the conversation about whether to pursue a fourth ablation needs to be very individualized. What if I'm in the blanking period currently? And the blanking period is the first 3 months after an ablation. During this time, recurrences, including atrial tachycardia and even flutter, happen in up to 50% of patients. And here's the critical point. Many of those resolve on their own. A recurrence in the blanking period does not mean your ablation failed. The guidelines are clear. Early recurrence is best managed with medication or cardioversion, not with rushing back to another procedure. What if I'm older or have a larger left atrium? And those are real factors. Older age, a larger atrium, longer AFib duration, female sex, and more persistent forms of AFib are all associated with higher recurrence risk. That doesn't mean ablation won't help you. It means your treatment plan needs to be more carefully tailored, and it makes operator experience critically important. High-volume centers with experienced electrophysiologists consistently show lower recurrence rates and fewer complications. In our center alone, we do hundreds of these every year. Here is what I want you to picture. Imagine 2 years from now, after a thoughtful, structured treatment plan, your AFib burden is dramatically reduced. You're sleeping through the night. You're exercising without fear. You're not watching your chest at every moment, wondering when the next episode is coming. That is not some far-fetched fantasy. That is what the data shows is achievable for the majority of patients who work through this process with the right team. Drop a comment below and tell me where you are in your AFib journey. Only 18% of viewers said they were thriving. Let's get that number as close to 100 as possible. After the final ablation, including all repeat procedures, long-term data from over 5,000 patients shows freedom of AFib at 5 years at over 80% for paroxysmal AFib. Even for persistent AFib, outcomes improve substantially, and after year 2, the late recurrences drop to roughly 2% per year. The path forward exists, you just need to know which direction to walk. So, here's your challenge. If you've had a recurrence after ablation, don't sit on it. Don't wait and then hope it goes away on its own. Have that conversation with your electrophysiologist about which of these options is right for your specific situation, your AFib type, your symptoms, your anatomy, your history. And if you want a head start on that conversation, if you want a clear, organized resource to help you understand your options and walk into your next appointment prepared, go to fightafib.com. There's a free AFib action plan waiting for you there. It's designed specifically for patients who want to restore their rhythm and reclaim their life, not just manage AFib, but actually fight back against it. And if you want to go deeper on the specific techniques used during repeat ablation, pulmonary vein isolation, posterior wall isolation, substrate modification, and how they compare in terms of outcomes, that video is coming. Stay tuned and subscribe so you don't miss it.